During this episode of Making the Rounds, we'll be discussing Banner Health's newest facility, Banner Sports Medicine Scottsdale, a one-stop destination center for sports medicine and performance services. Making the Rounds dives into medical topics with those who know them best, healthcare providers. My name is Bridget, and I'll be your host for today's episode. If you're new to our podcast, thank you for tuning in. And if you're a regular listener, welcome back. Joining me today on Making the Rounds is Dr. Evan Werk, primary care sports medicine physician at Banner University Orthopedic and Sports Medicine Institute, and Shelly Massingale, senior director, service line administrator over orthopedics and sports medicine, and is also a physical therapist specializing in vestibular and balance therapy. Thank you both for joining me, and welcome to Making the Rounds.
Thank you for having us.
Dr. Werk, tell us a little bit about yourself.
Yeah, so I'm a primary care sports medicine physician, which means that I was trained in family medicine, and then I did additional training to be able to manage healthcare conditions and injuries, specifically in athletes, both professional and weekend warriors. So kind of all level of athletes. So my goal is to treat athletes non-operatively for their musculoskeletal injury, as well as any medical conditions they may have, and get them back onto the field as quickly, as safely, and as well as possible.
Wonderful. Thank you. Shelly, give us a little background. I'm really excited to hear. So you're our service line administrative director for our orthopedic and sports medicine, but you're an active practicing physical therapist as well. Give us a little background.
I am. So I've been working with Banner for 26 years. So I started as a neurological physical therapist in one of our outpatient departments downtown in Phoenix, and was fortunate enough to start working with athletes and met up with Dr. Steven Erickson, who is the medical director for our concussion center, as well as the chief of primary care sports medicine. So he and I opened our concussion center. And I specialize in balance therapy. It's dizziness and balance problems, really now post mild traumatic brain injury. So any type of concussion, I treat any of the symptoms related to dizziness and balance. I still treat, but not that often, because I'm now in this administrative role, which is so much fun. I work with Dr. Werk all the time. I'm really helping to build sports medicine and orthopedics, but primarily sports medicine across our system.
Thank you. Thank you both for being here. This is a really exciting topic, not only for Banner Health, but also our community. So Banner Health offers a wide range of healthcare services in the Valley, but our newest center is really one of a kind since it combines sports medicine and a state-of-the-art high-performance center within the Scottsdale facility. Shelly, can you explain what types of specialized services and programs are going to be available?
Absolutely. So this building is truly a destination sports medicine center. And really the reason why I say that is we have so many different services that will be offered in one location. For those of you that don't know what's in the Scottsdale Sports Medicine Center, it's an 80,000 square foot building. It's 3 levels. And on the first floor, we'll have a Banner physical therapy suite. We'll have a full Banner imaging suite, so a 3T and 1.5 MRI and a CT scanner. And then the majority of the space on that first floor is the High Performance Center. And the High Performance Center is one of its kind in the state of Arizona, as far as I know, but brand new to Banner. So it has been the most exciting project to work on. We will have the highest technology possible for movement analysis, looking at force plate analysis of all different types of sports for athletes of all ages. That's the first floor. The second floor will be our clinic floor, and that's where Dr. Werk will be. We'll have close to 48 exam rooms that will house all fellowship-trained orthopedic surgeons, as well as fellowship-trained primary care sports medicine providers like Dr. Werk. And then we'll have a full concussion center on that floor also. And the concussion center is a multidisciplinary center that has all different specialties in there. So really that floor will service any type of athlete injury. So any body part or joint that you have an injury to, we will have a provider to help serve those injuries, and then could refer down to physical therapy if they need rehab, refer them over to imaging if they need imaging. And then the third floor is our surgery center. So if they do need surgery, then these same orthopedic surgeons will be doing all of their outpatient surgeries. They're at the ambulatory surgery center. So it is truly a one-stop sports medicine destination center that houses injuries. We treat injuries, but we also will be doing the injury prevention in the high performance center.
Thank you for that overview. Now that we know, Shelly, what a high performance center is, and we know what a sports medicine clinic is, what does this fusion look like, and what does this mean for our athletic community?
That's one of the best questions you could ask. I think that's the most unique part of this center. So the way to start this is the High Performance Center is very different. So it's going to be a community-based center, which means that any one of us in this room can go in and use these services. But it's not necessarily like a gym like you would go to like Lifetime Fitness. Okay, so it's more of a high-tech performance training center. So Bridget, when you were telling me before we started this that you're a runner, right? And so you run maybe a mile a day, but you want to get to a place where you're running maybe 10Ks or maybe a half marathon. You would be a perfect person that could come in, and what we could do is we could do a full running motion capture analysis on the way you move. So we do it on this specialized treadmill that we have. We have high-tech camera systems that are looking at the way you move. Plus we can look at what the force is like going through your legs. So when you were saying that if you run more than a mile or two, you start to feel like that pinch in your hip, right? So what I would be doing is, well, not me, but the clinician would be looking using this high technology to see how are you running? What's your movement like? How efficient are you with running? And then with that, we'll be able to develop an individualized program for you to help you improve the efficiency and the way that you move. And then end goal is to get rid of the pain in your hips so that you could get to being able to run a 10K or, a half marathon. So everybody's goals are different. You are a perfect example of anyone that can come in and do this, right? Now let's pivot over to our pitching and hitting tunnels. So now I have a high school pitcher that wants to go to college pitching. So we have the same motion capture systems. So looking at the way that this athlete moves when they throw, we also have force plates in the ground that are looking at how does the lower body affect the way the upper body moves. And then from there, be able to put that all together in a report and a program that specifically will help this athlete get to whatever their goals are. So if it's that he wants to be able to pitch faster or he wants to be able to pitch longer in a game before he gets too tired. We have all different types of ways that we can help improve that athlete's ability. So what the Performance Center is doing is it's really enhancing our athletic abilities already, and everybody's goals will be different. So we have pitching and hitting tunnels, we have a half basketball court with force plates embedded in the court, we have a full golf swing suite that can do the same thing. Everything's motion capture, and then we have the doors to the High Performance Center roll up and they go out onto a 3/4 length football field where we could do any type of turf sports, running sports, and analyze movement in that way. So that's the different side of medicine. What we're doing in that center is we're hoping to prevent injuries versus treating injuries, right? And then also enhancing our athletic capability. And it's really a center that offers this kind of support to an athlete that usually you would see at a collegiate or professional level. And we're going to offer it to athletes of all ages and all sports. So how does that coordinate with the second floor is your question, right? Well, the wonderful thing is that we will collaborate with our physicians on the second floor. And all of these physicians are so knowledgeable. So this collaboration will help us. And I think Dr. Werk, he's already seen patients that he's going to talk about. That's a perfect example of this is how would somebody go from an injury down to the High Performance Center or vice versa? So maybe I have somebody that's in the High Performance Center with me and they have really injured their foot. No longer are they somebody that I would see. I would then bring them up to the second floor so that they could see the physician that specializes in that.
No, that's perfect. It's a great segue. So you shared what the Banner Sports Medicine Scottsdale highlights. It utilizes high technology and that multidisciplinary approach to care. And our sports medicine professionals create that individualized athletic-centric plans to optimize athletic performance. Dr. Werk, can you share how important this is and what this means for athlete performance, the recovery, the injury prevention? And can you give us a couple of examples like Shelly had mentioned, what you're already seeing in the clinic?
Yeah, absolutely. So Shelly mentioned it, but literally today in clinic, I had a high school softball player who I've been seeing. She injured her shoulder. And I saw her initially. We're able to get x-rays right there in the clinic. I'm able to give them a diagnosis. And then I have sent her to Banner Physical Therapy. When we move to Scottsdale, that'll be all done physically in the same location, which I think is the beautiful part of it, is we have direct communication with the physical therapist that will be working with the athlete to rehab that injury. So for her, she's been going to physical therapy and her shoulder is improving. And I was talking with her dad today, and her dad asked me, hey, I know there are other places we can go in town where I could pay someone to look at her throwing motion and analyze it to see how it could be more efficient or how we could prevent future injuries. And me as a physician hearing that, I think that's a great idea because I'm seeing the athlete when they're acutely injured. we're doing the physical therapy to get them back to their baseline. So decrease their pain and everything else. And that's really the key partnership with Banner Physical Therapy, is getting them back onto the field. Once they're back onto the field and throwing again, then a really crucial part of what we do is preventing future injuries. And I think that's where, again, we're able to, under one roof, take that same athlete, have them go to the performance center, and then they're able to use our technology to look at her throwing motion, look at her footwork, look at her core strength and everything else to gauge, where her throwing motion may be falling apart a little bit to prevent this from happening in the future. I think that's kind of the key partnership, and something that currently is really hard to do. And my background in primary care, I'm always looking at ways to prevent injury. Most of our medical system is geared towards treating injuries after they happen. So that's where the surgery comes in, that's where the physical therapy comes in, and everything else. But no athlete wants to wait until they're injured to figure out what they could have done better. So I think the Performance Center gives us the ability to, during high school physicals, evaluate their motion before they're injured, try to identify areas where things are breaking down a little bit, and be able to, number one, enhance their performance, right? Maybe get them to be able to throw a little bit faster, a little bit further, swing their bat a little bit harder, get their bat speed up. We're able to do those things, but we're also able to identify places where things are breaking down, and that may result in a future rotator cuff injury, biceps tendinopathy, et cetera. So as a primary care physician, that's something that I've always dreamed about, but it's hard to do in an insurance managed system. So doing that in the Performance Center gives us the freedom and the ability to partner with that center to make sure that we're treating, our elite level athletes, our high school level athletes, everybody similarly, to try to keep them on the field as much as possible. And like it or not, keep them away from seeing me for as much as we can. There aren't many situations where we get to actively do that with our community. So I think that that's the most important part of this partnership between the two sides.
Thank you for that. You mentioned partnership and you mentioned the community, Dr. Werk, and you're the medical director with Ironman Arizona. And then we have some key physician leaders as well within the orthopedic and sports medicine division. Dr. Evan Letterman and Dr. Stephen Erickson serve as the head team physicians for the Phoenix Suns. Dr. Amy Overland and Dr. Leah Brown serve as the head team physicians for Phoenix Mercury. Dr. Amy Overland is also the team physician for Tempe Union High School District. So sports medicine care and collaboration within our community is really important to Banner. Can you tell us about these community partnerships and what that means to our community, the professional teams, the youth programs, the school athletic programs? What does that look like? What is that vision?
So for me, it means being able to engage with our community at so many different points and levels, right? So we know that the most visible partners that we have are our professional partners. So be that Ironman Arizona or the Phoenix Suns or the Phoenix Mercury, those are all very visible entities that we work a lot with and help care for their athletes, which I think is really important. But I think more than that, it's partnering with the high school athletes and providing them the same level of care that we're providing when we cover a Suns game or a Mercury game or a Diamondbacks game. That's really our goal, is to not only be a place where people come to get healthy or have surgery, but a place where we can engage with our community and actively go out into the community and serve these athletes. So I have covered Camelback High School for the last 8 years. And I think one of the most rewarding parts of my job is to go every Friday night during football games and be literally on the sidelines taking care of those athletes. And then turn around a few months later and be on the sideline at a Phoenix Suns game. And you're able to engage with both of those communities. And I think it's an awesome thing to be able to, again, provide the same level of care for high school athletes, professional athletes, the triathletes who are weekend warriors, or just people who are out doing, 5Ks and 10Ks. I think that's really the goal, is being able to provide the same level of care for all level athletes, including your recreational athletes and weekend warriors, and provide a little bit back. I think the other key thing that partnering with some of our professional organizations affords us is the ability to provide lower cost physicals for some high schools and do some of these broader kind of community service programs too, to make sure that pre-participation physical isn't a barrier for kids to participate in high school sports. Kids these days need to be engaged in physical activity for mental health and physical health, et cetera. So whatever we can do to lower that barrier, I think is helpful. So being able to provide, going out into the community and provide these physicals for our athletes so that they're not waiting weeks to get a primary care appointment and not being able to play their sport because of the timing. I think that's huge. It keeps them engaged with their high school communities and those social engagements as well.
Thank you, Dr. Werk. Such incredible services that we're going to be providing to the community. Shelly, Banner Sports Medicine Scottsdale, in the clinical setting, it's your typical referral pathway. We accept the major insurances that Banner Health and the Banner Health Network are contracted with. But can you explain how the High Performance Center is unique when it comes to access? What do those athletic packages look like? Does it differ from the weekend warrior to the collegiate athlete to the club player, the high school athletics team? What does that access look like?
Really good question. So everything in the High Performance Center is on a cash pay service level. When you think about the High Performance Center, it is healthy individuals coming in there. So any injuries that occur would then go to one of the other locations that we've described, and you would be billing that under medical insurance. So let's just go back to you, Bridget. When you come in, you want to do a running analysis. The cost for that running analysis is going to vary. It's going to be based on what it is that you really want to do. So do you want to come in and do one analysis and get your individualized program and then go back home and work on it on your own and you don't see us again? That would be a cost. If you wanted to come in and do the analysis, have some training with our specialized coaches, maybe 4 times a month, and then be reevaluated and then continue on with the training till we get you to your end goal of running a half marathon, that would be a different pricing structure and less in cost because you're doing a little bit more with us, right? The community partners that we have will also have a different packaging. So we're partnered with Phoenix Rising, and Phoenix Rising is a youth soccer club, and we will likely do some of their high performance training with their elite teams in this high performance center. So they'll come in as a team. So when you come in as a team, if you're coming in twice a week, there'll be a set cost per athlete or a cost per the club. So it's all varying based on what you're looking for, what your individualized goals are. The one thing I think that's been, to me, the most rewarding in this entire project is to be working with our Banner Health foundations. They're raising funds for athletes that may not be able to afford these kinds of services, because what our vision is we're offering this to everyone, to every athlete, and ideally to these youth athletes that normally wouldn't have these types of services, and not everyone can afford that cost. So we are raising funds through our community partners to allow all of these athletes to be a part of these programs. We have one fund called Game On and have raised a significant amount of money that Dr. Werk was just talking about, where we're able to offer pre-participation physicals to athletes that are unable to pay the $25 for the physical. And that's money that's raised 100% through our Banner Health Foundation. But also part of that is an injury prevention program. We've been raising the money, but we haven't had the facility to offer this injury prevention program yet. And so that's a big part of what we'll do when we open up the High Performance Center, is we're going to roll out this injury prevention program for athletes that may not be able to afford it. And what we do is they can come in and they don't have to pay, but that's covered through the Game On Fund. So there's a lot of opportunity. It is a cash pay service. However, we are open to seeing everybody in our community.
Dr. Werk, we've spoken a lot about athletic performance and the injury prevention and recovery, but what does the center have to offer when it comes to athletic injuries?
Absolutely. I think one thing that we provide is we, again, partner with Banner Physical Therapy, and we have athletic trainers that are out in our community at these high schools. So these are athletic trainers that see the injury happen in real time on the sideline, whether it happens in practice or at the game. So if someone is, I think football is an easy example, right? We have a football player who's in their sophomore year, they make a wrong turn on the field, and they have a knee injury. The athletic trainer evaluates them on the sideline, and they're not sure whether they tore their ACL or they just sprained their MCL and what needs to happen. The athletic trainer has a direct line to talk with our athletic trainers that are in our clinics and get them in to see one of our sports medicine specialists, whether that's a surgeon or a primary care sports medicine specialist like myself. Either one could serve that athlete. We have a way to get them into the clinic quickly, which is our goal, to diagnose their injury. So say they're seen with me on a Tuesday afternoon in clinic. I'm able to do an x-ray when they come in. They're in the same building on the same day of their appointment, and then I'm able to evaluate them. Let's say they tore their ACL. I'm able to tell them that day they tore their ACL. And then I would schedule with Banner Imaging for them to have their MRI done, maybe not the same day, but in very short succession in order to coordinate that and make sure we get the MRI quickly. They get the MRI and we confirm that their ACL is torn. Great. I talk with one of our surgery colleagues, such as Dr. Letterman, Dr. Carter, Dr. Shaw, and Dr. Brown, get them in with one of them that could do the surgery. They then schedule the surgery on the 3rd floor in the coming week or two after they've done the appropriate rehab and strengthening beforehand. And they have surgery done on the 3rd floor of the surgery center. Anyone who has had an ACL tear knows that that's only the beginning of the story. But we're able to tie those pieces together really quickly in succession and with actually physically talking to our colleagues. So I can walk, 25 yards down the hall and talk to one of the surgeons about the particular injury and the sport they play, et cetera. Then, after they have surgery, they can go down to the 1st floor to Banner Physical Therapy and start their rehab. And as we know, that's a long process for after ACL reconstructions to do their rehab. They go through the physical therapy, and 8 or 9 months later, we transition them back out onto the field. And we can do literally all of those steps within this one building, tied with our partnerships that we have in the community. So it all can go through one pipeline with seamless communication, all through one physical entity, which I think is the really unique thing. Let's say the same thing happens for a concussion and an athlete, same football player, and maybe a different football player, okay, same practice. Bad day for the athletic trainer. But they have another athlete go down that gets knocked down, and they're concerned about a concussion. We can do the same thing for concussion management. So I manage concussions as well. That athlete would see the athletic trainer. The athletic trainer would contact our clinic athletic trainer, who would put them on my schedule in the next 48 hours, say. I would see them in clinic and diagnose their concussion, as well as what else they have going on. Do they have headaches? Do they have balance problems and balance issues that I need to have Shelly see them for? Do they have cognitive issues that we need to have them see neuropsychology? Do they have vision problems that they need to see a neuro-optometrist or an occupational therapist that works on functional visual retraining? Which one of those things do they have? Well, it doesn't matter because we have all of those specialties right within the physical clinic in the concussion center that's built on that 2nd floor. So if an athlete comes in and they have those issues, we're able to tie them immediately into those therapies, do those evaluations to make sure that we have them on the road to recovery and get them back onto the field as quickly, but most importantly, as safely as possible once their concussion is recovered. And I think a lot of the medical side of our Banner Sports Medicine Scottsdale Center has grown from what's already being done at our Banner Concussion Center, which has been around for over a decade now, that Shelly helped start with Dr. Erickson. And that's having all of these people under one roof. And I think the value of having direct communication with everybody who's treating your athlete is really key in making sure they have the correct care and therapies. We're doing the right thing for them to get them back on this field as quickly and safely as we can.
Thank you both for taking the time to speak with me today. And we're really excited about sharing these services to the community and, what's more to come at the Banner Sports Medicine Scottsdale, the one-stop destination center for sports medicine and performance services.
Thank you, Bridget.
Thank you very much.
If you would like to learn more about the sports medicine specialist and programs available at Banner Sports Medicine Scottsdale, please visit bannerhealth.com/sportsmed-scottsdale. And if you'd like to learn more about the services offered at Banner Sports Medicine High Performance Center, please visit us at bannerhealth.com/high performance center for more information. Thank you for listening, and we'll see you next time on Making the Rounds.